folks. Welcome to Healing Outside the Box. My name is Jean Tiberio, and I'm a nutritionist and wellness coach. Today we have episode 268, and I'm calling it Statins. How do they work, and why should we care? First, a disclaimer. My background is in nutrition, and I was trained with relatively mainstream nutrition courses, and then later veered off into the preventative arena, or as we might say now, functional nutrition. So, although I have a doctor, I am definitely not a doctor. You should always check with your doctor if you want to know more about whether or not statins may work for you. Statins, by the way, are the most common cholesterol-lowering medication, but there's also another type that I'll get into later. But first, it's probably a good idea to start with a rundown of why we might actually need cholesterol and what the quote-unquote normal values are. It turns out that cholesterol is necessary for a few reasons, not the least of which is that it is involved in the making of vitamin D. So, for example, when you're out on a beautiful sunny day, the sunlight on your skin will turn 7-dehydrocholesterol into precalciferol. And after a few more steps, active vitamin D, or calciferol, is made in your kidneys. Cholesterol also makes steroid-like hormones, estrogen, progesterone, testosterone, and it makes bile acids that are essential for digestion and absorption of those fat-soluble vitamins. Vitamins A, D, E, and K. Also, cholesterol is involved in the synthesis and proper function of our cell membranes. Now, we get cholesterol from food, specifically animal products, but we also make cholesterol in our liver. The ratio is about 70% of total cholesterol made by your liver and about 30% coming in from the food. But our bodies can also make cholesterol in our ileum, which is the third part of our three-part small intestines. So our body makes whatever we don't take in from food. Now, when you go to the doctor's office and he says he's going to check your cholesterol, it will generally look something like this. It's called the blood lipid panel, and here's what it tests for. Total cholesterol, which ideally should be less than 200. Now, some doctors, if you have other risk factors, might want you to get far below 200 to give yourself, some wiggle room. Between 200 and 240 is what people used to call the borderline range. And your risk of having a cardiac event, as your doctor might call it, depends on your other risk factors, which we'll get to in a minute. Okay, the next lab is your triglyceride level. This should ideally be less than 150. It can be elevated in people who are overweight or people with diabetes. Triglycerides, by the way, are the storage form of fat. It is 3 fatty acids attached to 3 carbons in the shape of an E. The next value is HDL, or high-density lipoprotein. It's actually a ball of several substances, and it's thought to be our good cholesterol fraction because of its function, basically. The cholesterol in the HDL may be going to the liver to be destroyed, or controlled, as we would say. The LDL is the bad guy. It should be less than 100, and some people say less than 90. Again, if you have other risk factors, your doctor might want you to get it below 90. Elevated cholesterol is only one risk factor, but there are others, as I'm sure we know. There is elevated blood pressure, or hypertension. There's diabetes and prediabetes. Prediabetes is a situation where our blood sugars can run high during, say, times of stress, or when we're sick, or perhaps after Thanksgiving, but then may eventually go back to relatively normal numbers. Gestational diabetes is the diabetes that happens during pregnancy, and if that's the case, women may have about a 50% chance of developing diabetes later in life. And then we have an overall relatively unhealthy diet or weight gain. And then there's physical inactivity. But they say you don't have to be engaged in any intensive sport to get the benefits of activity. Walking should do it. But they encourage activity every day. And that's the key point. Now, another risk factor is a family history of early heart disease. And by early, they mean for men 45 or younger, for women before the age of 55. And then there's just plain age, which we can't do anything about, but it's listed anyway. Age 45 for men and age 55 for women. And after menopause, if you're a woman, your HDL factor starts to drop as your estrogen goes down and your testosterone goes up. Okay, so what do these statins do? Statins, generally speaking, block a substance that your liver needs to make cholesterol. So your liver doesn't make cholesterol, which results in your body getting the cholesterol out of your bloodstream to do what it needs to do. Now, I'll give you a list of all the statins in the show notes, but basically the most common ones are Lipitor, which is also called atorvastatin. We have Zocor, called simvastatin, and lovastatin. There is also Lipid, formerly called gemfibrozol, but this is not a statin. Lipid works by decreasing the amount of stored fat or triglycerides in your liver. This could be helpful if you have diabetes as well, which is associated with a higher triglyceride level. However, like statins, a higher dose of Lipid can result possibly in elevated liver function tests, which could be a sign that your liver is working harder to metabolize all of that Lipid. Low doses of all of these meds are usually considered to be relatively safe on the liver. But your physician, if he's doing his job, will check your liver function tests about 90 days after your first dose and every time your dose level is raised. If you have a fatty liver and or abnormal liver tests, ask your doctor if it is safe for you, not if it is right for you, like the ads say. There's a review article put out by NIH, which talks about the risk and benefits of the statins. I'll put it in the show notes. Now, statins have been around for a long time, and they have been changed and improved over the years. I first encountered statin use when I was working in a cardiologist's office way back in the 90s, and at that time, people's liver function tests were creeping up on higher doses. Again, ask your doctor if you are curious about any possible side effects, because everyone's case is an individual one. And please don't stop taking any medication without discussing it with your doctor first. Now, statins work by slowing down the production of LDL cholesterol in the liver where it's made. Again, because your liver then isn't making cholesterol, it takes cholesterol out of your bloodstream to make those things that it's needed for. So your blood cholesterol levels will fall. So you probably don't need to know this, but statins will slow down cholesterol production by blocking an enzyme called HMG-CoA reductase. Some statins may lower your triglycerides as well. But as a nutritionist, I feel like I need to say that because triglycerides are literally the storage form of fat, technically the best way to lower your triglycerides is to do that naturally by lowering the fat intake from food. Although they don't get the same bad press, triglycerides are linked to liver disease, heart disease, and diabetes. Like all medicines, statins can sometimes cause side effects. The The most common side effect is muscle aches. This is also called myalgia. I've read somewhere that this is a side effect in about 15% of patients taking the statins. So you might feel this pain as a soreness, tiredness, or general weakness in your muscles. The pain can be a mild discomfort, or in rare cases, severe enough to cause muscle spasms. The fancy word for that is fasciculations. Again, bring this up with your doctor before stopping any medication altogether. There's one group of statins that might be more likely to cause these muscle aches, and they're called lipophilic statins. Sounds like fat-loving or more fat-soluble. And those are Lipitor, Zocor, and Lescol. The hydrophilic or water-loving statins include Crestor and Pravachol. These cause fewer muscle aches because they do not penetrate muscles as much. Another common side effect might be stomach upset or loose stools. Yet another possible side effect is irritability or anxiety. I will give you the link to an NIH article on that one if you're interested in reading further. Now, if you have a side effect and discuss it with your doctor, one possible option is to switch to something like Lipid. My job as a nutritionist is to let you know that if you're on statins, you will need to avoid grapefruits or grapefruit juice. Now, grapefruits normally are a great citrus fruit and a good source of antioxidants, but grapefruit has been shown to slow down the metabolism of certain medications in your liver. A slower breakdown of the statins in your liver means that the drug can accumulate and maybe increase your liver function tests. This is yet another possible side effect. And again, only your doctor would know this, but if you already have a fatty liver and are taking a relatively large dose of these statins, you can actually be at risk for a medication-induced type of hepatitis. Okay, right now you might be thinking a couple of different things. Do I have a fatty liver? Believe it or not, that might be a good question to be asking if you're above the age of 40 and are holding on to a few extra pounds, which means you're a typical American. But only your doctor can answer the question about what they're calling non-alcoholic fatty liver disease. The second question you might be asking yourself is this: is there a good way to avoid taking a large dose of statins? Well, I'm so glad you asked. Let's go back to the 70-30 ratio of where you get your total cholesterol. 70% of your cholesterol in your blood, that's approximately, comes from what we call biosynthesis. It is made in your liver or in your intestines. 30% comes from food, and cholesterol only comes from animal foods. There is zero cholesterol in any plant-derived food. So if you go vegetarian, you can drop your total blood cholesterol significantly. A cholesterol below 200 is recommended, but we will have plenty of cholesterol for our bodies even if our blood cholesterol is 150. So technically, if you do nothing but add plant foods, you can theoretically drop your level to a blood cholesterol that compares to an optimal level of statins. If you add daily physical activity, you may be able to reduce your cholesterol even more. Add to this, plant foods have lots of soluble fiber. The soluble fiber can technically bind some of that cholesterol and send it out your back door. Add to this, you are also lowering your saturated fat level because you're taking away some animal products. To me, this is an important point. If you take away cholesterol and take away some saturated fat by reducing the animals you eat, it will make a huge difference. That also means your triglyceride levels in your bloodstream will be lower. And that, as we've said, can lower your risk of diabetes, obesity, and heart disease. Now, speaking of weight, in general, more plant food and less animal food will mean that you will likely lose some weight. It doesn't have to be a huge amount. Losing, say, 20 pounds means that your blood pressure will also drop. So you have just knocked off 2 more risk factors for heart disease and stroke. Now add to this, fruits and vegetables have a lot of antioxidants. We all know that they can fight the growth of tumor cells, but antioxidants also reduce inflammation that can lead to more plaque buildup in your arteries. Now, have I been flapping my gums all this time to suggest to you that you may have more success lowering your cholesterol with diet alone? To that, I plead guilty as charged. And I know I sound like a broken record if you've been listening to these podcast episodes, but you don't need to simply eat salads or plain vegetables to make a whole foods, plant-strong diet work for you. Now, do you have to be a total vegan or vegetarian to make this work for you? Of course not. This is your choice. And we all know that nobody eats perfectly, and you certainly don't have to make this work for you. My job is to help you feel educated about the choices out there you may have. If you need any suggestions, tips, recipes, etc. to help you on your journey, just email me on my contact page, which is healingoutsidethebox.com. Just click contact at the top, and I will be happy to help. And remember, if you'd like to lower your cholesterol, you are certainly not alone. Please feel free to join our tribe by leaving your email, and I can send you more tips, recipes, and future podcast episodes. As I see it, we can all help each other to eat healthier, live healthier, and reduce the pain of chronic illness. That's all I have for you today. Be well, and stay tuned next week for another episode of Healing Outside the Box.